Hi everyone. This is Team 11, and today we are going to be talking about the Marcous family. Today we have presenting with us Lyle, Jaspinder, Dawa, Angelica, and myself, Kayla. Okay, so we'll get started by discussing a little bit about the Marcous family and their history. So, um, we have 5 family members in the Marcous family. We have Kevin, Lorinda, Josh, Isabella, and Kate. Kevin and Lorinda are married. Josh and Kate are married, and we have Isabella as well, who's the youngest daughter. Okay, so the Marcous family are of Portuguese descent. They moved to Canada in 2018 from Portugal, and they currently live in a 3-bedroom apartment in Mississauga, Ontario. Kevin Marcous is a 70-year-old male, and his wife, Lorinda Marcous, is a 65-year-old female. They have been married for 42 years. They have 2 children, a son named Josh Marcous, who is a 40-year-old male, and a daughter, Isabella Marcous, who is a 28-year-old female. Josh is married to Kate Marcous, and she is 35 years old. They have been married for 5 years. All of the family members are practicing Catholics. Josh is a college graduate and is currently working as a supervisor in a factory. He lives with his wife, parents, and sister. His wife works as a cashier in a grocery store. Isabella is working part-time as a cashier at Tim Hortons. She is also studying at an adult school to get her high school diploma. The entire family lives in a 3-bedroom apartment. The Marcous family's combined salary is enough to support their financial expenses. Overall, the family's socioeconomic status is low. Both Kevin and Lorinda lived their whole life in Portugal. Neither of them speaks much English. Kevin was a farmer in Portugal and has an equivalent of a 5th grade education. Lorinda never completed any formal schooling. Her main occupation has been as a homemaker and caretaker to her family. Due to their language barrier, their current situation is that they are both currently at home and unemployed. Lorinda does all the housework. Kevin wants to work and support his family financially, but he is having difficulty finding work due to the language barrier. Sometimes he feels helpless about their family situation. Kevin's personal medical history includes hypertension, hyperlipidemia, depression, COPD, and osteoarthritis. All of his medical problems are currently well controlled with the exception of his COPD, which he occasionally has an exasperation of. He is a pack per day smoker and has been for 40 years. He is currently on medication to help control his symptoms of COPD. Lorinda has type 2 diabetes, hypertension, hyperlipidemia, osteoarthritis, and gout. She is on metformin for her diabetes. Overall, her medical conditions are stable. Josh has a history of depression, and he is not currently on any medication, and Isabel and Kate currently have no medical problems. So for the presenting health problem for our family is that when the COVID-19 pandemic hit, the Marcous family was gravely affected financially and emotionally. Josh and Kate were not getting enough hours at work. Similarly, Isabel's workplace was temporarily closed due to insufficient sales. Therefore, their income has been reduced and it has become very tough for them to manage their expenses. It has become stressful for the whole family. There is increased tension resulting to frequent arguments among the members. Kevin, as the head of the family, feels the most depressed. He cannot do anything for the family, especially now that older people are the most at risk for acquiring the virus. Due to the stress brought on by the situation, the parents are also at risk for developing various stress-related illnesses. Josh has been informed that his workplace has a COVID-19 outbreak. They shut down the factory for 24 hours to properly sanitize the building before returning to work. 5 days later, Josh develops a fever, chills, cough, and loss of smell. He goes for a COVID test and it comes back positive. He is told by public health to isolate for 14 days. His wife must also self-isolate due to being in close contact. Neither of them has paid sick time, and therefore for the next 2 weeks there is no income coming in for the family. 1 week into quarantine, Josh develops severe dyspnea and is sent to hospital. He's admitted with hypoxemia and requires supplemental oxygen to breathe. None of the family members are able to visit Josh because they are all in isolation. Kate feels she should have a significant role in her husband's medical care because she is his wife. Kevin, on the other hand, feels as the head of the family, he should be directly involved in his son's care and should be consulted when making decisions. The two are constantly in quarrels with each other about how to help Josh when he is discharged home.
Hi, my name is Dawa Dolma and I'm going to talk about Marcous Family Assessment. Based on our assessment, the factors that we have identified that have affected the family health pattern and practice are Kevin and Lorinda old age, their language barrier, family low socioeconomic status, Kevin current health status as COPD, being a new immigrant family here in Canada, ambiguity, confusion of roles, and the presence of threat of being exposed to COVID-19. As seen above, the Marcos family does not have an emotional bond with each other, and strange because of their individual job. They rarely interact and have a deep connection with each other because they have to make ends meet. The effect of lack of communication have become more noticeable when COVID-19 hits. The members are involved frequently in argument and misunderstanding and thus failing to cope with change brought by pandemic. On the other hand, if everyone try to listen each other's opinion, then they may foster understanding and come up with a solution to manage their situation. Kevin is frustrated as he cannot fulfill his role as a family provider or at least contribute to fulfill the family needs. In addition, regarding the role for maintenance and management of the family system, especially for decision making, Kevin is in constant argument with Kate regarding who will be the primary caregiver for Josh and who will decide for him. Kate is a Josh's wife, but as the head of the family or the household, Kevin insists that it should be him. Less serve-form communication problem contributed to conflict and ineffective problem solving by Bray. As a nurse, we can suggest some idea that mitigate the generational difference, like suggesting for the participant to recognize their belief and value. Moreover, we can let them understand there's a lot of different motivator and each person might motivate by something different from other, and arrange a way for people from different generations to communicate each other with respect. It is important to note that communication is still key in addressing generational difference that might affect the family health care pattern and practice. We can also help them identify increasing frustration and conflict, as this can be the first step in solving this kind of issue within family. Despite staying here in Canada as permanent resident for 2 years now, it is still a problem for Marcous family to completely acclimate to the Canadian culture. Usually, individual and family are still considered as a new immigrant here during their first 5 years of immigrating. Although individual, this is already a work in progress for Isabel because she is attending an adult school. This is also address any issue regarding language because she can hone her English language skill with this. But as a family, this is difficult is evidenced by low socioeconomic status, culture difference, language barrier, especially for Kevin and Lorinda.
Often, families here in Canada consist of 3 to 4 generations. That's why generational differences play a vital role in family dynamics and how family members interact with each other, since each generation is different with regards to their upbringing, values, and principles. Therefore, it might also have an impact on their healthcare decisions and practices as an individual and collectively as a family. Generational differences play a part on the family dynamics and relationships between family members. Kevin is 7 years old, which means he is a baby boomer. On the other hand, Kate is 35 years of age, making her part of the Generation Y, or more popularly called as millennials. As for Kevin, according to Majors 2018, baby boomers prioritize word-of-mouth recommendations to influence where and from whom they seek healthcare. On the contrary, the millennials, to which generation Kate belongs to, expects ease and accessibility when it comes to information, and, according to Majors, are less likely to seek care than older generations. Regional differences is not a problem, as they all live in the same province and the same household. Additionally, interethnic exposure was also not addressed in the scenario, thus having no problem regarding this aspect. How might you demonstrate manners such as profound acts of kindness, courtesy, respect, and politeness to the family? As a professional nurse, it is important to present ourselves in a positive manner towards the family, as it will help build a long lasting relationship with them. Respecting family culture and their beliefs is important to develop cultural awareness to avoid biases and stereotypical behavior towards the family. According to RNAO 2015, these are a few examples on how a professional nurse demonstrates proper manners in a professional setting. First, introduce yourself and your status. Second, explain your role and the timeline of your involvement with the person's care. Third, ask the person how they prefer to be addressed and always address the person by this name. Next, prior to initiating care, collaborate and seek the person's agreement to proceed with care. This will ensure that it is a good time for them and that you will have their attention. When proceeding with care, take the time to explain the care step by step and provide information using clear and straightforward language. Be reassuring when they are expressing their fears. Then, do not rush the person. Provide them with time to process what is being said and to ask questions or provide feedback. Use positive, non judgmental responses when speaking. For example, use the terms with positive associations such as health needs or diagnosis instead of problem. Accept, repeat, and validate your understanding of any information that the person provides about their experience of health and their health care. Adjust your communication style, such as your tone of voice, loudness of speech, and pauses, to accommodate the person's needs, such as their developmental stage, age, cognitive status, and language and literacy levels. Explore with the person how they want to raise concerns and ask questions. Clarify information and inquire who is responsible for their care. Provide clear and timely information in ways that are affirming and useful to the person and confirm with them that the communication met their needs. Reflect on whether your manner and your self communication is meeting their
To
needs.
continue the topic about therapeutic questions, we are asked what five therapeutic questions would you ask and engage the family in? What are the challenges your family is facing right now, and what is your primary concern? So, our group came up with these questions of how does this problem affect your family generally and individually? How do your financial situation and living condition affects your family? What do you think are your family's strengths? How can we collaborate with your family in regards of a plan of care? Do you have any questions or concerns about the healthcare system and service here in Canada? When asked, what psychosocial considerations are important to examine for your family? These psychosocial considerations are medical care, financial status, social support systems, couple emotional status, education and work, and family background. Next up is the commendations for the Marcous family and individual strengths. And these are the ability to still work and go to study during a pandemic, dedication to one another, resiliency, strong family bonding, ability to cope during stressful situations, Kevin's decisiveness and role as the primary decision maker, Isabel's determination to have Canadian credentials, and strong practice of their faith. As nurses, we could also add that this difficult time that has brought plenty of problems for you. However, it also has revealed your strengths. Despite the pandemic, Josh and Kate have continued to work and support the family while Isabel has continued to work and study. Lorinda and Kevin took care of the house. This shows your dedication to each other and the family as a whole. Lastly, even though there have been numerous arguments within your family, no one has given up nor has anyone left. This illustrates that there is hope for this family with the right help and intervention. Regarding family care plan, when asked what tools would you use to engage and support the family? As a group, we identified family assessment and intervention model, and secondly, it's the family genogram and family eco map. Basing on family assessment and intervention model, families are vulnerable to tensions when they are stressed. The family's reaction is determined by how profoundly the stressor penetrates the family unit and the family's ability to adapt in order to preserve stability. The fundamental family structure must be safeguarded at all costs, otherwise, the family would perish. The work that the family does to maintain or restore family unity is known as reconstruction or adaptation. Moving forward, the family assessment and intervention model is one way that health professionals can conceptualize about change, and that's according to Wright and Leahy 1994. That being said, as nurses, our interventions take inspiration from the family assessment and intervention model to promote changes in their dynamics and interactions within the family in accordance to their needs. A case in point would be specifically reconsidering and restoring Kevin and Kate's relationship with one another. With this, it would minimize or even eliminate conflicts between them and foster a team spirit with each and every relationship that coexists within the family. To provide a solid rationale for our tool of choice, according to Wright and Leahy, as cited on nursinganswers.net, it was stated that this model is widely used among nurses for assessing a family in the goal of resolving issues among the family. Secondly, the family genogram and family eco map displays the family visually and graphically in a way that provides a simple description of family complexities. The family genogram provides a rich source of information for planning intervention strategies. The eco map represents the essential connections between the nuclear family, extended family, and the community around it, offering an overview of the family in its current context. And that's according to Kakinen et
Hello
al.
everyone, I am
2015.
Jaspinder and I will be discussing the priorities for the Marcus family. The first priority is financial assistance. Josh and Kate have lost their jobs and the Marcus family is currently in financial crisis. The family should be provided with the resources to meet the basic needs for their living. The second priority is family communication. It has been found that the Marcus family do not communicate much with each other. They do not interact with each other. There's a lot of frustration among Kate and Kevin. The third priority will be role ambiguity. There is a lot of frustration among Kate and Kevin in relation to who will be the primary decision maker for Josh. All family members do not have defined roles of the family functions. The last one is cultural and language barriers. Being new immigrants to Canada, Kevin and Lorenda struggle to adjust to the new environment. Both of them are unable to speak English, and therefore it has been difficult to find a job to support their family. The next is interventions that should be implemented to this family. The first intervention will be the family should be directed to government financial resources to help meet the financial crisis, such as CERB or EI. Family members should be educated about government assistance programs available and how they can apply for it. Second intervention can be poor communication can lead to family conflicts and lack of emotional bonding. The family members should be encouraged to formulate and participate in family routines. The Marcus family should be encouraged to have their meals together. They should be encouraged to listen to each other and appreciate one another's efforts. The third intervention will be roles should be divided among family members by mutual agreements. At this time, Marcus family should have clear division of role and responsibilities with mutual understandings. This will decrease the burden on the family members and will also reduce the conflicts and misunderstandings among the family members. The last one is the Marcus family should be directed to newcomer services available for new immigrants. These services will help Kevin to find a job, learn English, and learn about community services available for new immigrants, which are free of cost. These services will likely improve their livelihood and sense of belonging to Canada. Thank you.